Hello, my name is Charmin Foth, and I am the Public Relations and Marketing Manager for Quadriciser Corporation. And I'd like to talk to you a little today about how the Quadriciser Motorized Therapy System has been used successfully in an assisted living or long-term care facility.
As administrator of the #1 nursing home in the whole state of Georgia, that's according to U.S. News and World Report, isn't it?
Yes, it is. We're very proud of it.
And tell me what you think about the Quadriciser.
I think on top of everything else we do, it's a fantastic addition. We've seen great results. My therapists love it, my nurses love it, and above all, as you can see, it's benefiting the patient in many ways.
Yeah, it's huge.
Let's talk a little bit about mobility. And the Quadriciser brings back mobility to some of your patients that may have otherwise been on a downward spiral. It makes transfers more efficient and less cumbersome, aids in incontinence issues. It helps with hygiene issues. The more mobile a patient is, the more likely they are to want to get up and be bathed and do things like that. Residents view mobility as a means of freedom and choice, independence. They feel like they're doing something on their own, something where somebody isn't having to push or pull on them, but something that they feel they actually have a little control over. So it gives them a sense of freedom. You see almost immediate improvements in their well-being and their self-esteem. That sense of well-being and self-esteem shows across to their families, and their families see that, and it's something that makes them happy. So the families are happy, and happy families make a big difference in your bottom line. It keeps people in your facility, it keeps your beds full, and people want to go where they know that their families are being cared for. The Quadriciser gives a lot of added benefits that you don't think about.
And what is some of the big benefits you've seen with other clients that you've got here?
Improved mood, improved ambulation, just more better posture, and just they seem more alert. It seems like they're just having the blood flow has also just stimulated their cognitive abilities. Just being as far as alert and aware. And again, like I said, the mood.
Seriously, one thing for me is that a lot of our folks here on campus are having improved self-esteem because of being able to have something that they're successful with, because they struggle with a lot of things, and there are challenges with doing lots of different physical activities, but when they have one that pretty much does the work for them, but they feel the results from it and things, they feel successful. So their self-esteem and confidence is just skyrocketing, and Ike is a perfect example of that.
So has it helped the morale of the nursing home?
Absolutely. And we just had a family weekend where our families from out of state came, and some of them did a formal in-service with us with the Quadriciser, but some just toured on their own time and looked at it and were just extremely impressed and want to know more. So,
Do you think it might
interest.
encourage other clients to come here because of it?
Oh, I think it's a strong marketing tool.
The Quadriciser can be used as restorative therapy because it's something that everyone can do. It improves the circulation. It works on the whole body system, moving all four limbs in that cross-crawl, quadrupedal motion that would be hard for a therapist to do themselves and get that range of motion. It helps improve your lung function. It helps with dysphagia. It helps with contractures. If you have someone who's severely contracted, there's usually a lot of pain associated with that, so it helps ease the pain of contractures as well as loosening those contractures.
It has helped with our range of motion. With restorative care, one of it is doing range of motion for either passive or active. And those that are able to do it on their own, we help them, we motivate them to do it. We've developed a schedule that's according to their likings, and we have them, and we make sure that they're staying as long that it'll benefit them. And also that it's at a setting that will give them a little bit of resistance, so they're actually benefiting from the exercise. And then for those that need the range of motion done, it helps, one, free up staff, because now the machine can help do some of that range of motion for them.
It also gives the therapist a little sense of freedom because they can get them in, they can get them set on whatever regimen that they feel they need, and then the therapist can keep an eye on them, but the therapist can fill out paperwork and can do other things. So it becomes an adjunct tool to where they can utilize and multitask a little bit more. Quadriciser offers something that most machines don't, where it actually gets your hands and your arms above your head, so it helps increase your heart rate. So it gives you a cardiovascular workout on a level where someone has been totally inactive, a gradual progression, I guess, that you can take with a Quadriciser, where it gets them up to the next level of therapy. So you can go from restorative care to probably bringing that patient back into a standard therapy setting, which they wouldn't normally be able to do. So you're bringing more patients into your therapy setting where you may not have been able to do that before.
Good. One thing I forgot to mention, when I first started doing this, say a month ago, he was, after 10 minutes, he was huffing and puffing, and he was literally about to fall asleep when we finished. His cardiac status was so poor. But now he can go through 15, almost 20 minutes, and he's popping off of it. He's fine. So it
Not
really
a
has
problem.
elevated his,
That's good.
cardiovascular health.
Let's talk a little bit about transitioning from restorative care to standard physical therapy, occupational therapy, or speech therapy. Many of these therapies can be done in conjunction with the Quadriciser or with the Quadriciser. We've had many physical therapists tell us that they have had improvements in their patient's gait, in their balance, hand-to-eye coordination, their stability, where their contractures melted away, and they were able to progress from maybe doing seated therapy to actually getting up on the parallel bars and walking, or to adding a kickball into their routine where they had enough stability to actually stand and kick.
And what is some of the benefits that you've seen?
Well, I've seen better range of motion. I've seen people that were contracted able to open those contractures, and we haven't had it for that long, but I cannot wait a year from now and see where a year from now we'll be with some of these folks. I've seen people walk down the hall straight and good posture that normally don't have good posture. The repetition is just phenomenal, and they look forward to getting on it. Residents come up and ask us if they can get on it today. Of course, everybody has a schedule, and it's based on what the therapists feel the greatest need for that particular person is. And once again, I refer you to the patient themselves.
I've had speech therapists tell me that they loved the Quadriciser because it worked with the right brain and the left brain at the same time, and that circulation to the brain helped the patients respond more appropriately to questions that they were asked. They like to do flashcards because their response times were quicker. Their responses were much more appropriate than maybe they would be otherwise. Everyone wants to know about billing, so I can tell you that in the past we've had facilities successfully bill on a number of different codes. Of course, restorative care, gait training, neuromuscular reeducation, therapeutic exercise, and therapeutic activity and sensory integration. I don't know what the code changes for 2011 are going to manifest. I'm sure that there's going to be something comparable that you'll be able to bill on, or maybe even existing codes with a little bit more detail. If your general population is using a Quadriciser, the majority of that population begins to show improvements. They can be reconsidered for more traditional therapies. You can increase your therapy revenue because you're bringing patients that normally wouldn't be considered for therapy into therapy. And that can be, a really big boost for your therapy programs and your billable hours. Part of my job here at Quadriciser is to help our customers. Anytime that I can help with a marketing plan or setting up an open house, getting press releases, basic information out about the Quadriciser to your local media groups and networks, so that you can showcase the Quadriciser, and I am here to help you do that. And if you need anything at all, please contact the office and let me know. Thanks. Have a great day.